130 people die each day from opioid abuse. Georgia specifically has the 11th highest opioid death rate in the country. Anyone is susceptible, and it only takes 4 days to become addicted. Perhaps most shockingly, 80% of opioid addicts relapse after treatment. This is a growing problem, so changes to treatment are needed. Research has shown that continued care services provide the best support to prevent relapse. Opioid-specific continued care programs do not currently exist in Georgia. For this reason, we will partner with the nonprofit DeKalb Community Service Board's Fox Recovery Center to implement our program, Third Arrow Recovery. The Third Arrow Recovery Program consists of a community-based and an individual-based intervention. The community-based intervention includes 3 parts: group formation, monthly education modules, and data collection.
Group formation occurs while participants are concluding their formal treatment at Fox Recovery Center. The program liaison is an addiction psychiatrist who coordinates with stakeholders and oversees program operations. Leads are certified addiction counselors tasked with running monthly group meetings and supervising graduate students. Each lead oversees 2 groups. Graduate students with a background in addiction psychology will help support participants and run operations. 4 graduate students are assigned to each group, and each group has 25 to 30 participants. Each module takes place over 3 months. These research-based education modules are specific to opioid recovery. For example, Module 2 is all about stress management. Recovering addicts have up to 3 times the number of stress biomarkers as compared to those without a history of addiction, and is positively correlated with vulnerability and relapse. Our stress management module addresses anxiety and depression, compassion-based training, and other creative outlets for stress. We will collect subjective and objective data throughout the Third Arrow Recovery. Surveys will be distributed to access program efficacy, while hair samples will be collected as an objective measure of participant sobriety. The individual-based intervention consists of weekly calls from graduate students to monitor each individual's progress and needs.
Investments from various stakeholders are required to facilitate the success of Third Arrow Recovery. Besides DeKalb Community Service Board's Fox Recovery Center, other stakeholders include the local government, who has invested not only in the health of its population, but also in the healthcare cost of opioid treatment. Additionally, donors will ensure the long-term funding and sustainability of Third Arrow Recovery, and most importantly, the participants and their support systems. Salaries are based on responsibilities and credentials. In total, our budget comes out to $250,000. The $250,000 investment in Third Arrow Recovery seeks to diminish the emotional and financial costs that the opioid epidemic has on Georgia communities.